Everybody, Dr. Steve Greene here. This is the Make the Grade Experience podcast. We're talking about all things that contribute to your success, to contribute to your positive mindset, to contribute to helping you reach your goals. Today, we're going to include in that your wellness, your health, your physical well-being, your mental well-being, because you could make an argument if that isn't in place, if you're ill or you're in pain or you're just uncomfortable or you're just off kilter, it's going to affect all the other things. Your mental can absolutely affect your physical. I firmly believe that. So we have a special guest today. I always get excited about guests, Dr. Michael Cheng. Dr. Mike, how are you?
I'm doing great, Dr. Steve. How are you?
It's a beautiful day. It's a little cold. We are both in the Philadelphia area. It's like, I don't, it might even be below 10. It's like really cold for us here.
Seven right now.
But it's
Yep.
hot and toasty where I am. Why don't you give a little bit of a background? Like, again, a little bit, how'd you get to where you are today? I know you've been a chiropractor many years, a very
Mhm.
successful one, a very good one. In full disclosure, I use Mike as my personal chiropractor, and I'll just say I've had a positive experience.
Thank you
So
very
tell
much.
us a little bit about yourself. I know you're from beautiful Kansas City, or Kansas at least, but I'll let you take it from there.
Yeah, so I was born and raised in Taiwan and moved to the United States with my parents when I was 12. And we lived in the Kansas City area. My parents are still there, but I moved here in 2002. Decided to become a chiropractor because of my own personal back problems that I had when I was 15 after a basketball injury. And then that kind of steered me towards finding the solution for my back without drugs and surgery. And chiropractic was that solution. So that inspired me to become a chiropractor to help those who are suffering with the same type of pain or injuries that I had. So I've been in practice for about 21 years now in the Philadelphia area.
What would you say is your main motivation? I'm sure you have maybe even countless number of patients, but I'm sure they all have different ailments. But is there some commonality? Is there, kind
Yeah.
of your philosophy on chiropractic? I know there's sort of different schools of it, so to speak, but
So, in my philosophy, the body has the ability to heal if you allow the body to do what it needs to do. And the central nervous system controls everything in your body. So it's like, breakers in your light, in your panels in your house. If some type of power outage happens, the breaker is off, then that power from, the source going to wherever it needs to go is shut off. So to some extent, the nervous system is kind of like that. You got to find the area where there's a misalignment of some sort that shuts off the nerve signal to that end location. So we have to realign it to restore that power. That's the best analogy I can give you.
I like that. So it's your wiring, probably
Yeah,
literally, right?
it's
So let's talk about your new toy. I
yeah.
happen to have a little secret here. I got some insider info. Mike has brought into his office a new device that may literally change some people's lives, maybe a
Mhm.
lot of people's lives. It's not brand new. He didn't invent it, but I think it's got some really exciting potentials. And really, we're going to focus today on this. So, what's the exact name of this device? What does it do? And who do you think would benefit from it?
This device is called Emscope Neo, and
Got it.
it was designed and put together, I believe, in uh, off the top of my head, it's Eastern European country.
Okay.
Um, I'll think of it when I get there. I think it might be Croatia.
Okay.
Um,
That was developed.
and
Hmm.
it's been used around quite a bit. I would say for the last 5 to 10 years at least. But I recently stumbled upon it, went to a great conference, met a lot of doctors. Exactly, what you can do is it can literally melt fat in stubborn areas and increase muscles in hard to exercise regions in your body
Mm.
in a very short period of time. So, people around this time of year, they want to, get back to the gym and start their fitness journey on some level. And this could potentially jumpstart that, or people who can't exercise due to, some type of injuries they had, and this can also help with that, either to improve range of motion or restore functionality.
What how does this work? So is this something somebody wears? Is this something that
Now,
you would administer as a health professional? How
so
long does it take?
this can be done only in a professional's office. It is
Okay.
a device in which we put these applicators on whichever body part you want us to improve upon. And it's a 30-minute session, and it's non-invasive. I don't want to say it's painless, but you definitely feel certain type of intensity through the treatment. But there's no blood, there's no
All right.
needles of any
That's
kind,
good.
and there's no downtime afterwards. That's another plus. So we say it takes about 4 to 6 sessions for you to see the optimal results in about 90 days because the body needs to absorb the fat to excrete from your system and also get the muscles underneath to come up above the fat where you can see more visibly. So essentially 90-day period, 4 to 6 sessions is the optimal time for people to see some type of result.
And this would mimic or replace what type of maybe surgical or more invasive medical procedure?
Well, I think the most obvious is any type of liposuction, plastic surgery of any kind, at least on the body to improve the appearance. But
Nice, which is definitely a lot more
oh, of course,
invasive for sure. Well, you have to, well, maybe you don't know. Anything natural is not a quick fix. It's
nope,
not taking a pill. It's enabling your body to recenter and balance, and then your natural healing can come into the forefront more. I can tell you, as part of my research, I always research these things. I have had a couple sessions. It's really I found it very relaxing. It pretty much is laying on a treatment table, kind of going for about a half hour, and you can feel a benefit the next couple days for sure. And I think it's more lasting. Is this something that uh, I mean, how many of these treatments are done like nationally? Is there any statistic of proof of concept? Is there any like there's been 1,000 cases and 996 reported, X number of
well,
inches lost? Because everybody, let's face the truth here, Mike. Everybody wants the results, but not everybody's willing to do the work to get it, right?
right.
Everybody wants the quick fix. So talk a little bit about, what's the bottom line? What can people expect in terms of maybe something more measurable, like inches of loss or body tone, something along
Yeah,
those
I
lines?
think it's there's definitely fat loss by about 30%, maybe 20 plus 25% plus in muscle mass gain, and I mean the company even went as far as taking biopsies in the muscles and then look under microscope to see if it actually increased in size.
Okay.
So, something that's measurable, but in terms of, a layman, we take preferably a before picture and an after picture, and after, 4 to 6 sessions, so people can actually see some type of visible difference on their body. In terms of how many cases have been done, I think it's thousands because I think nationwide, and this is around, not just in this country, but I think 70 other countries around the world that are
Whoa. Okay.
using this technology. So I know at least in the United States, there have been, I think, 14, 15 at least clinical studies that has been done on this particular device in the last year or two, just to
So
see.
is there any like exhaustive training you had to do I mean, to be able to, I know you obviously have the degree, you have a lot of education. I happen to know Mike's also a certified MRI technician. Is that correct? Right?
That's correct.
So this is somebody who's invested a lot of time in his own education and professional development to his credit. Um, So I assume you have whatever credentials are needed. This is not like, hey, where do I put this thing?
Sure, sure.
A little better than that. So you got any show and tell? Is there anything you can show us?
Yeah, yeah. I do have a little presentation. I kind of just give people a little gist of.
Okay, so those of you in video land are going to actually see what Mike's going to show. Those of you in audio land, I will try to do a little synopsis, but you should be able to share the screen. Let's see what we got.
Okay, give me 1 second here.
And while you're loading it up, Mike, if somebody, so by the way, this is Steve Greene, Dr. Steve. This is the Make the Great Experience podcast. We have our guest today, Dr. Michael Chang, chiropractor extraordinaire. He's got his new device, which helps change your body composition, reduce fat, tone muscle. And here comes the share. Mike, real quick, how would somebody get a hold of you if they want to learn more about this, just in case they're short on time listening?
Yeah, sure. They can call my office, 215-443-5626, and we can set
There
up
we go.
a 15-minute free consult and even a 5-minute free demo. Or they
Good.
can
There we
visit my
go.
website for more information, www.drmikecheng.com. We're
All right.
currently updating our website as we speak as
There
well.
we go. And we'll put that into the show notes as well. So those of you who are listening, Mike started a slideshow, Advanced and Innovative Technology for Body Contouring and Performance.
Yes.
Go on. Let's see.
All right, so this is the actual device. It looks like I don't know, ice cream.
Yeah, it does look kind of like an ice cream dispenser.
Yeah, yeah.
It has the
So,
opposite, but it has the completely opposite effect on your body.
but it does two things here. It uses what's called radio frequency (RF) to heat
Hmm.
up the fat that's right below the dermis, the epidermis, the skin, and
Okay.
then uses what's called a HIFEM, which is a high intensity focused electromagnetic energy
So you got
under the
two things
muscles
driving it.
to
Okay.
stimulate. All this in 30-minute session. Okay. It is
Well, let me add one thing for those people who may
sure.
have had a treatment. If you ever had like a TENS,
Mhm.
that's what's called like TENS.
Tens.
One of these things where they put these kind of pads on you and it forces your muscles to contract or to vibrate. It's a very similar feeling. I'm not sure if it's the same technology. So you have radio frequencies hitting the fat. You've got another vibration stimulating the muscles at the same time. So here we go. Uh,
Yeah.
EmSculpt is cleared by the FDA. That's
Yep.
important. So some people that know what they're talking about have looked at this to do
Yep.
one, two, three, four, five things. Tell us about it.
So it can break down the fat called lipolysis of the stomach area and your thighs. So it can help reduce the circumference of those regions. You can improve the tone, strengthening of the abdominal muscles, to develop more firmer, musculature underneath. So even postnatal patients who has had babies or even had C-sections, this might be able to help them.
Hmm.
Um,
Okay.
and you can, look at different body parts where you can firm up the buttocks, the thighs, the calves, the arms. So
Hmm.
overall, any part of your body that is, not exactly where you like to be in terms of the firmness, this can help and also decrease the fat on top of it.
So we're looking at, I think the most, maybe, I don't know, I'm going to guess, maybe the most common complaint from people is their abdomen.
That's correct. The
I
abdominal
think,
area, the stomach
probably
area,
yeah,
weakest
a close second would be your waist. I use that term, non-medical,
point.
thighs,
Mhm.
backside,
Yep.
calves. This isn't necessarily something you're going to do like on your leg or something.
Yeah. Well,
Um,
underarms too, older
oh,
people.
that's right. Yeah, yeah.
Yeah.
I forget what there's a thing women call them, which I can't remember.
The tricep area.
There we go. So, yeah, is there any situation where this is counter? Oh, here we go. I was going to say, is it counterindicated? And he's got a counterindicated
So
slide here. So go
yeah,
ahead.
so very interesting enough. I work in an MRI environment quite often. And before anybody goes in to have an MRI, we usually have these safety questions to make sure there's nothing inside of them that's either metallic, electronic, that could interfere
Hmm.
during the procedure that can affect their health. So anybody with some type of pacemaker, defibrillator, stimulator, any type of metal implants, drug pumps, we pretty much say you're not a candidate for this type of procedure.
Hmm.
Uh, and a lot of times these people can't get an MRI either. Anybody with any type of, tumors, some type of lacerations, some type of, contagious skin problems, Anybody who's pregnant, we usually say, this is not the time for you.
All
Uh,
right.
Now, somebody who's had a baby or whatnot, usually we say, maybe 6 months after you deliver, because,
Mm.
usually you're still nursing. So we want to make sure it doesn't interfere with any part of what you're trying to do.
Let me ask you this question. Let's say somebody was not necessarily even overweight. Would this also have like a toning?
Absolutely.
So there's positives. This is not limited
No,
simply to I don't know if this is the way you would present it, but like a weight loss,
no,
body
exactly.
sculpting sort of process. This could also be kind of in the sort of other direction, a positive
Absolutely.
toning,
This is
strengthening.
the toning, strengthening, the improving in terms of function and performance, depending
Hmm.
on if you're an athlete or whatnot, which we'll talk about a little later in my presentation. So
There you
we
go.
we have
I
one aspect.
remember like I don't know, 6, 8 years ago, I fell off my bike and hurt my elbow. I
Mhm.
had to do these exercises just
Yep,
with my one arm.
yep,
And I'm wondering if something like this might have accelerated that. Okay, keep going,
absolutely.
keep going. This is good. And I
Yep.
want to be a little bit mindful of time, but go ahead. So technology.
So
So this is high
technology,
tech,
so
right?
these are the paddles or applicators that actually goes on
Hmm.
the affected area that we want you to put this on to treat. So like I said, it has the synchronized radio frequency that melts the fat, and then the hyphen paddle. So this is literally inside this circular region that emits this frequency. Okay.
Hmm.
So as you can see, fat has the highest resistance, so it accumulates heat, and this paddle penetrates through the dermis layer, which is the skin, into the fat and the muscle underneath. And depending on how much fat you have, obviously, it might take longer time to melt that. But ideally, we want to melt the fat, which destroys the fat, the cellular wall in the fat cells. And eventually, it shrinks the actual fat through time. So this is kind of like give you a breakdown exactly what the actual skin and fat and muscle layer looks like in a cross section. Okay.
Hmm.
And if we look at the actual application, um,
So just for those of you who can't see this, in the picture Mike's showing, there's the skin layer, then the
mhm,
fat is next, and then below that would be the muscle. And I assume that's
yes,
consistent in all areas of
correct.
the body. So this device, which looks kind of almost like a big ping pong, almost like a pickleball paddle ish,
Yep.
has the strength to penetrate into the fat, through the fat as
And the muscle.
well, with the different types of transmissions
That's correct.
into the muscle. So you're getting a dual benefit.
Correct.
And when you say melt the fat, you're not talking like putting on a frying pan
No, no, no. But
and
what happens is with the radio frequency, the RF,
Mhm.
it's literally raising the temperature in those fat cells, which then eventually destroys the cell wall. So there's another common type of contouring method called cool sculpting, where they actually freeze your fat. We're actually doing the opposite. We're melting it. That's why I'm using that term. We're
Mhm.
heating up the cells to destroy the cell wall. Okay, and in return, we can get faster results as a result of this particular application by melting the fat and increasing the muscle underneath. So most people don't even realize this. When you do some type of exercise and you do some type of cardio actually only burns calories in your body. But if you want to burn fat, essentially you have to work the muscles because the muscles is the one that actually burns the fat by raising the
Mhm.
metabolism. So in essence, this particular session treatment, we can burn the fat while increasing the muscle volume. So afterwards, your muscles continue to grow, which continues to, burn the fat that's on top of it.
So I'm just going to read off Dr. Mike's
Yeah.
screen here. This treatment
Mhm.
is the equivalent of 20,000 muscle contractions in a 30-minute session.
Yeah.
Produces, here's a good word for everybody, supramaximal contraction, which surpasses voluntary contraction. So if I'm interpreting this correctly, it's kind of like if you're putting on somebody's stomach area, it's like
Yep.
they're doing 20,000 sit-ups in a half hour. So
Correct.
it'd be like you took a video and then you put it on like 10x.
Yep. Yep.
And a super maximal, that's probably pretty serious.
Yeah.
So what it's basically saying is this would be stronger. Like if you sat there and went, oh, I'm contracting my muscle as hard as I can, it's even more than that's even possible in your own sort of pushing it sense.
Correct. This is
Beautiful.
above what your body can actually do.
So I guess it would lead to let me ask you this. I'm not sure how many more slides you have. We'll get through them. But if somebody's sitting there going, yeah, this is just another device, is once a week enough? Is 6 times enough to have a sustained effect? And I think part B of the question would be, there's got to be at least a little bit of lifestyle, right? Like somebody could
Absolutely.
come into your office, have this treatment, and go eat 2 gallons of Haagen-Dazs. Yeah, you can't complain if it doesn't work as
Absolutely
well as
not.
it could.
So there's that gotta be some type of nutrition plan with regards to what we're doing here because you gotta eventually watch what you're intaking while we're doing this treatment to get the maximum effect in the shortest time. Now, obviously, the goal is to promote wellness. So we want to get people to do certain things to change what they're doing so this way they can affect their health better overall. This is just another, I guess, a life hack that we can help them speed up that process, essentially. So,
Well, there's no secret. We're not here to talk about our national health concerns, but
yeah.
I think it's maybe even common knowledge. There's a high level of obesity, a high
Mhm.
level of people just in less than optimal health. All right, let's keep going here. Let's keep going. So, if you have any questions, and you're listening to this, absolutely put them in the comments. Going to know how to reach Mike. So he's going to talk about sort of the actual application. So there's a thermal sensor.
Sensor.
Okay.
So this sensor is actually going to detect what the body skin temperature is. So, as
Hmm.
I said earlier, we want to make sure this is done safely while this is on your skin. So this makes sure it doesn't burn anyone as we heat up this fat underneath. Okay. And essentially, we want to make sure it gets to a certain temperature to actually do the effectiveness of what we're trying to do here, which is melt the fat. So 43 degrees Celsius is what this paddle needs to get to. And this sensor is what sends that temperature. So nobody ever can say, I got burned one. Now, also during the treatment, either myself or one of my, assistants will be coming to make sure the patient is in a comfortable setting.
Yeah, that I can confirm. So 43 degrees Celsius for those of you who aren't metric savvy
Yes.
is I'm going to say about 105
Yep.
Fahrenheit
Yep.
plus or minus.
That's correct.
I know this. I know 37 Celsius is 98 because over 30 that's like your body temperature. All right, so here we go. The thermal profile. So your fat heats up to like over 100 degrees.
Yep.
The muscles maybe the fat's maybe like
Well,
102, 103. The fat's
yep.
maybe 100. The muscles a little bit cooler.
That's
Um,
correct.
so the combination, is it heating up because it's contracting? Like
Well,
if you go running, you're going to generate heat, right?
correct. Correct. Well, also you're getting more blood flow, circulation.
Nice.
So, yeah. So essentially, we're increasing the body temperature by heating up the fat cells while stimulating the muscles underneath. So it's really doing all that
Yeah,
simultaneously.
right. I think that's important that people understand is
Yeah.
you have a double effect here, which probably has a third sort of synergistic combined effect.
Absolutely, absolutely. So
And now
once
we
it
get
gets
we
to the
go ahead.
desired
Yeah.
temperature, it kind of
Mhm.
just stays in that area to make sure it has that constant effect to get the most amount of fat loss during this procedure. Okay. And while we continue to contract the muscles, but the contraction is not continuous. It stops so the muscles doesn't go into what's called involuntary contraction or
Like
spasms.
like a cramp almost.
Yeah, you don't want anybody to have a cramp when this is happening. So
Hmm.
essentially, it's in a temperature control environment.
Okay.
We definitely heat up the tissues, within 4 minutes, and then it detects what the body is saying, so it doesn't overheat your body underneath your skin. So it
Hmm.
really does, all these things simultaneously while the patient is laying on their back in a comfortable position.
Well, this is all the safety. Go back to the slide before for 1 second. I want to give everybody a vocabulary word here because we
Mhm.
are about education a little bit, right?
Mhm.
Um, I hope I'm saying this right. Apoptosis.
Yep, apoptosis.
Apoptosis?
That's
There you
called
go. So
self.
everybody, so
Yep.
I'm going to say that's a fancy word for fat burning, right?
Yep,
So there
we're
you go,
literally building
everybody.
the
Don't say you
cell.
didn't learn something today.
Yeah.
Apoptosis. Apoptosis. All right, let's keep going. Let's keep going.
All right, so essentially, this is kind of the visual what we're looking at.
Yeah,
We're
there we
literally
go.
shrinking the fat cells from this blob into little raisins. That's exactly what's doing. So this takes time, but at the same time, that's what's happening underneath the skin. Okay.
And
So,
if
like
you
I
couldn't
said,
see the picture, basically it's showing a fat cell that's, let's say, the size of a grapefruit, shrinking to about an orange down to like a
a
raisin.
raisin. There you go. Perfect. Perfect.
Um,
So this particular treatment is faster than what you could do potentially at a gym. From 12 to 16 weeks resistance, we can literally decrease that to maybe 4 to 6 sessions on a
nice.
weekly basis. Okay.
Everybody wants easy.
Yep.
Listen, what's easier, laying on a table, putting a temperature controlled thing on your area of concern,
Mhm.
and 12 weeks later, you're looking like Charles Atlas or Raquel Welch or whoever, not to date myself. So there you go. You got the fat decrease, which everybody wants, muscle
Mhm.
mass increase, which everybody
Yep.
wants. Maybe I'd say most people say I want to lose fat. They kind of forget because in the
Yep.
long run, the increased muscle maintains your higher metabolic profile, right? So by
Correct.
increasing muscle, over the long run, you're going to be burning more fat because you have more muscle. You got a bigger motor, so to speak. I
Correct.
learned all
That's
this when I
correct.
hired my personal trainer. Anyway, keep going, keep going.
All right. So
Clinical studies.
yeah. So 15 new clinical studies, more than 50 clinical investigators, using this hyphen technology. We have 30% fat reduction at 3 months,
Yeah,
25% muscle growth at 3 months.
nice.
The abdominal area, we have 19% abdominal separation, which means the muscles are starting to break and actually have more definition. And then
Hmm.
about 6 centimeters of circumference decrease around your waist, which
So
is
can you
significant.
quantify this? 30% fat reduction. What would that sort of translate into, say, in inches or pounds? Is
I
it
would say 2 or 3 inches, maybe depending on the person's starting weight,
okay?
maybe 3 to 4 pounds at least.
Okay, of fat, like just pure
Fat.
fat though.
Yeah.
So this
Okay.
isn't like water weight loss where yeah,
That's
I lost
correct.
six
We're talking
pounds
about
this week
actual. Yeah.
and I go
Correct.
drink a couple glasses of water and I only lost 2 pounds.
Correct.
Um, nice. Well, listen, what's not to like? Here we go. So now we got
So we
also can
we
help with pain
Yeah,
reduction.
so like you were saying, you fell off your elbow. So people who do physical therapy may or may not achieve the, optimal result, say 8 to 12 weeks. But, with this can also get to those numbers, in faster time, or people who done physical therapy, it didn't get better. This is something that we can do on top of what they've been doing because we can increase the strength of the muscles if they couldn't do it before or on themselves, and
Hmm.
then increase range of motion, which most people want to move better when they're feeling better, and overall retrain the muscles so the muscles have memory in the right direction. Okay, so these are just two doctors. One's a neurosurgeon, one's an orthopedic surgeon. What this machine has helped their patients since they start using this in their practice. So here's a very famous
Look at
athlete
that.
that we
Yeah,
have.
you're right. Well, at least in Philadelphia, but yeah. So tell us who this is, Mike?
Well, if you watched this weekend's game with the Philadelphia Eagles against the Rams, this is Saquon Barkley, which
It is him. A
yeah,
kind of young looking Saquon. Well,
yeah, this
he's
is
like a
probably a
20s
couple years
next.
ago. But this is him actually using the
Yeah, look
Emscope
at
Neo,
that. And this guy probably is in, I don't know, better
tip
shape.
top.
If there's 1,000 people in the room, he's probably in the top five.
Yeah.
I mean, it's not like
So
he's like, morbidly obese or really hurting. So he's probably doing this as a performance enhancing
that's
thing.
exactly right. Exactly right. So if you want to
Hmm.
call this having a competitive edge, this is potentially, one of the things that, athletes can do to boost up their performance without any type of drug enhancement or,
So you're saying if I next time I come back to the office, I can go run for 200 yards in an NFL game.
I'm not saying that, Steve.
Oh, somebody
Anyway,
can.
this is just like a reference of all the studies
There
that
you
they've
go.
done. Yeah,
So,
and
so
then
the short version to the listeners, this is hard science backed by
mhm.
hard science. One, two, three. I don't know. There's about 15 studies Mike put up on the screen. over several years. There was early as 20 something and go to more current.
That's years, yeah.
Hard science, anecdotal results, numbers that are showing this is very successful. Again, somebody wants to try this and they're within striking distance of where you are, which is in Southeast Pennsylvania. Why don't you give your number and your site again?
Yes, phone number is 215-443-5626. Website is
Okay.
www.drmikecheng.com. Dr.
There
Mike
we
Cheng.
go. So we got nothing to lose here except some extra fat, and I guess gain some muscle.
That's
Uh,
correct.
I'm going to encourage everybody, if you liked what you heard, or even if you're just curious, reach out to Mike's office and make an appointment, have a sit down, try a little taste of this.
Yeah.
Um, you can work on, can you do multiple parts of your body at once? Like, could you do your abdomen
So
and your thighs, or
yes,
is
you
that
can, but they recommend maybe like a 2 hour gap in between sessions
okay?
because they want to make sure your body temperature goes back down after the
Mm,
30-minute session. Remember, we heat up your tissues, right? They
yes,
want to
yes.
make sure your body goes back to the normal temperature. And
Okay.
sometimes we tell people, you can have one session first and then go out and do some errands and come back for the second session for a different body
Ah,
part.
or maybe you do one Monday, one Thursday, or
Something
whatever.
like that. Yeah, something like that. But if you
Okay.
want to do two in the same day, we want to have a couple hour in between.
So those of you who are listening to this, there's a picture on the screen of the paddles in
Different
various,
body parts.
yeah,
Yep.
legs, sides of the legs, abdomen, I guess, buttocks, biceps, triceps, calves, inner thighs,
Yep.
all the areas that matter. I guess you don't want to put this on your head, or we
Nope.
need to. Although some people say a lot of people have fat on
Right,
their
right,
head.
right.
Just joking, just joking. What do
Yep.
you all right, so let's talk about results. Here we go. Patient results. There we go. Ooh, look at the before and after picture. Very
Yep. So
noticeable.
yep, three
Definitely
months on top,
noticeable.
a month. So I guess for a female, they may need more time just because they have less body mass
Hmm.
or muscles compared to a male. But also depends on their genetics, their general health to start with. So, so you can see both 3 months and 1 month just depends on, gender, age, fitness level to start
Let
with.
me ask you this, because you're really in the health business, right? Do you, and
Yes.
this goes beyond Emsculpt, and by the way, it's EmSculpt as opposed to the letter M. Do you find that if you get somebody who's trying to kind of turn the corner, right? Maybe they've just let their health go because it's
Yeah.
easy to do. Everybody's busy. There's so many vices out there. There's so many ways, our food, I don't think is all that great for you a lot of the times. People drink too much, people don't exercise enough. The list is long and scary. But in your professional experience, do you find it if people say, "Hey, you know what? I'm going to start here." So they come to you, they maybe get a treatment or they do something else, and now they're starting to feel better. So maybe they start to exercise more and then they come back and they get adjusted again. Maybe they do this a little bit, and all of a sudden their whole trajectory has shifted, right? Now
Absolutely.
instead of going faster and faster down the path of lack of health or lack of wellness, they kind of stop the bleeding, so to speak, and now they're slowly and accelerating in a positive way, creating healthy habits,
And I also say psychologically, it boosts their confidence.
which is
It gives
super
their
important.
mind different whole entire outlook on life. And
Hmm.
then potentially we might give them anyway between, I would say, 7 to 12 years more on their lifespan because
Really
now you change your whole entire lifestyle simply because, we tweak a little bit, we'll give you a little jump start on the right path. That's how I see it.
love it, love it.
Mhm.
Yeah, he's Mike's just gets pitch shooting up more before answer pictures, which are before after, which are significant results.
Mhm.
Um, is there anything you did not get into? Because we're coming up on time a little bit. Anything you did not get into that you want to talk about briefly?
I would say, I'm open to have a conversation with anyone who is interested in improving their health, whether it's through chiropractic or through this Emscope Neo. Because I also find out, a lot of times when people go see their, health professionals, they are probably spending more time in the waiting room than the actual treatment room.
Yeah, sometimes.
Okay, so I want to make sure when somebody comes in to talk about their health, we address their issues and then trying to figure out what is the best solution for them to achieve their goal. Because,
Mm,
a new year, new resolution, but why is everybody having the same resolution without any particular, results? So somewhere they're falling through the cracks, or they're
mm,
not following through what they're trying to do. So hopefully, with what I have here, as well as just me as almost like a health coach, getting
hmm.
across the finish line, so to speak.
Beautiful. I mean, listen, ultimately, health is a personal responsibility. And sometimes people just get dealt a tough deal, as it were. But, in the end, if you're not well, you got to look yourself in the mirror to a degree and say, look, are there things I'm not doing I should, or things I'm doing I shouldn't? And I'm not excluding myself from that statement. So Mike's got an offer. You want to throw your offer out here?
Yes. So, right now we have an introductory package. Now, usually, if you go to a medical spa or plastic surgeon's office, you might be paying, 1,000 to 1,250 per session. But
Oh,
because this is a introductory rate, we're
okay.
gonna give you two packages. That ranges between $500 to $580 per treatment. So
Those are
package one,
significant savings.
yeah, you can buy four and then you can get two free
Okay.
100, and there's no, I would say, time lapse. You can pretty much use this anytime you want. But obviously,
Hmm.
we want to get you, depending on, like I said, what your start fitness level is. If you're pretty fit, we can probably do this, once a week for 4 weeks, and then you can kind of use the last two as a maintenance. After maybe like 4 or 5 months later, we can do another session. Or somebody who needs a little help, then you can get six. We can do 6 weeks straight, and you can use the last two for free for maintenance for the
Got
rest
it.
of the year or whatnot for $4,000.
So you're flexible. At some point,
Yep.
as you get busier and busier, the flexibility might be a little trickier, but
Mhm.
beautiful. So
Okay.
I appreciate you making that offer. I'm sure it's not limited to people listening to this, but if this is something you're curious about, you know the path. Make the call, visit the site, make an appointment to get into the office, have the conversation. If this is the right thing for you, and I think you'll probably know that after you have your sit down, right now it's about half price, basically,
Yeah.
and it's not always going to be there. So here we go. So let's close it up. Post-treatment considerations.
Mhm. Well, you might be a little sore afterwards, so we usually tell people it's like going to the gym for the first time. You might be a little sore, but you want to start,
Yeah, I can
hydrating
I
your
can
body.
tell you myself, it's nothing that's not gonna. It's not like you got to call in sick for work. I mean, you
Right.
could, I guess, but you'd be disingenuous. But yeah.
But most people might just feel a little soreness, but that also tells you, hey, we just worked your muscles. So
Hmm.
that tells you,
20,000
physiologically.
sit-ups, baby.
Right. So, but like I said, it takes about 90 days after the last treatment for you to see optimal result because the body needs to go through its transformation. Okay. But like I
Okay.
said too, we got to talk about what's a healthy lifestyle. What is your diet, in conjunction with this particular treatment. So this way you can get the optimal result long term.
Which
Okay.
is really the key.
Yep. That's the
I mean,
key.
that's really what everybody's looking for.
So, but like I said, reach me at my office. We can schedule an appointment, have a discussion, exactly what you're looking for, what can we do
Hmm.
to help you jumpstart your health journey.
Beautiful. Well,
Okay.
listen, this is Dr. Steve Greene. This is the Make the Great Experience podcast. We focus on your success, your wellness, your health, your ability to reach your goals. And again, I'm going to kind of close this out the same way I began, which is saying that you got to take care of all aspects, right? You got to take care of your physical health, your mental health, your emotional health, I guess. We don't talk about that as much here, but you should. Financial health, for that matter. And there's more to it, but this is in the physical wellness space. Perfect thing about it is it's easy. I mean, let's say as it is, right? You
Yep.
you, you go over, you lay down, half hour later, you got half your fat, whatever. You got your fat incinerating, your apoptosis, right? Apoptosis, my new favorite word. You got your muscles churning. What's not to like? Mike,
That's like
thank you so much for coming
these
on.
workouts
Is there
somebody's gonna
anything we didn't cover at all? We really didn't get into much beyond your science
I
here,
don't think
but
so. I think that's the general, idea I want to convey to patients or anybody who's interested to see if this is
mhm.
something that's, in their.
I'm going to do something they don't always do. I'm going to give a personal testimony. I've been seeing Mike for some time. I've known him for years. He's very professional. He does a really good job. So he could probably hype this up a lot more. This could have been like an infomercial. That's not my style. That's not his style. And I'm sure there's places out there where you're going to get kind of pushed at this. You need to do this, and and it becomes like a sales thing and kind of a icky kind of way. He's a genuine person who really cares about people, and that's a very high compliment.
Thank you,
And
Steve.
I appreciate it, and I think his patients that obviously none other on here, but I think they would agree. So I'm going to encourage everybody, find out yourself, take advantage of these offers, and you see how you feel. Let's do this. I'm going to make this proposal. Why don't we reconvene in some amount of time, and we'll talk about the journey. We'll talk about more. Obviously, in a few months, you're gonna have way more testimonials. I can share my own testimonial. I am being they still use the word guinea pig. Or is that politically incorrect here? I'm being a guinea pig in this process too. And I'm not I'm those of you who know me, I'm not like grossly out of shape. I exercise pretty frequently, but you got that like 10 pounds, 15 here and there that no matter what you do or not eat or I'm eating like, healthy. I'm eating like broccoli and quinoa for dinner instead of, yeah, sometimes you just reach a point, especially as you get older,
Harder.
metabolism isn't what it always was, and so on and so on. So I'm excited to try this. In fact, I'm going to be there in a couple days. But we'll report. We got some before and after pics to share. If you can't unsee them, gonna warn you right now. Once you see them, you can't unsee them, as they say. So make the phone call, visit the site, set this up. So those of you who are regulars, please share this podcast. I appreciate that. There are so many. The growth of this podcast is like 90% organic. I like to reinvest resources into making this the best I can. I got about 20 guests lined up all over the map. I got people who are experts in travel, kind of for your mental wellness. I got a guy who's a sommelier coming on, which is probably not the best thing after Mike's thing, but it's all about education. And I got lots of business people. I got lots of academics. There's some pretty cool stuff in the pipeline. I was just out of the office teaching at a business conference, 400 entrepreneurs, 400 plus. So I got a laundry list of them want to come on this podcast. So you're going to be getting a really good exposure to a very eclectic group of people. And I think this is going to just add as much value as we can. I'm going to drop a little tiny hint. I was asked on this um, cruise, this workshop I just taught at, to host a television show. How
Nice.
about that? So I got to bring some of my podcast guests onto my TV show with me. I got a phone call about that on Thursday, in fact, and we'll see where that goes. And believe me, I got a face for radio. So we'll see. They still want me. So Dr. Mike, thanks again.
Yeah.
Hopefully you got your winter coat out. But yeah, you came from a cold. It's not like you didn't grow up in Miami or something. So we deal with it. And I'm going to say, well, yeah, hey, Mike's wearing his Eagles shirt. He's repping it. We're coming into
Right.
the this week NFC Championship game. It doesn't happen every year, folks. Those of you who aren't sports fans, this is like a four-time in a lifetime thing. So we're taking advantage of it as well. Thanks, everybody. See you next time.
Bye bye.